Hello, everyone. My name is Brandon Zamora, and welcome to my final presentation on binge drinking among college students. First off, what is binge drinking? According to the NIAAA, which stands for the National Institute on Alcohol Abuse and Alcoholism, binge drinking is defined as a pattern of drinking alcohol that brings blood alcohol concentration, which is referred to more commonly as BAC, to a zero point zero 0.08 or higher. This means that typically in a 2 hour interval, males will consume about 5 drinks or more, while women will consume 4 or more, which could be 12 ounces of beer, a 5 ounce glass of wine, or a 1.5 ounce shot of any distilled spirits, such as gin, rum, tequila, vodka, and whiskey. What factors influence binge drinking? There are many factors that could potentially lead to binge drinking for college students. Some include, but are not limited to, the widespread availability of alcohol, little to none enforcement of legal drinking age laws, and having limited interactions with parents while away at college. Those who are considered more at risk for falling victim to binge drinking are students who are in their first year at the university, student athletes, and Greek life members such as fraternities and sororities. However, students who typically don't drink often are those who have been influenced by their parents thanks to being told about alcohol use and the harmful consequences that come with binge drinking. Why is drinking a problem for college students? The reason drinking is a problem for college students is because of the serious health and safety risks that come along with it, whether they are immediate or long term problems. Some immediate problems include car crashes, drunk driving arrests, sexual assaults, and injury, whereas a long term example would be liver and other organs being damaged due to binge drinking often. Severity of binge drinking. College students tend to more frequently binge drink and drive under the influence compared to their peers who don't go to college. According to a national survey, about 55% of college students aged 18 to 22 drank alcohol in the past month, while approximately 37% stated that they binge drink. From the same survey, there were some college students who stated they drank at least twice the amount of normal binge drinking standards, which is also known as high intensity drinking. For reference, binge drinking is considered 5 drinks for men and four for women, as I had previously stated in a previous slide, which means that this means that men who reported high intensity drinking consumed about 10 drinks, while women had about 8. Consequences of binge drinking. Some of the major consequences include, but are not limited to, death, assault, sexual assault, academic problems, and possible alcohol use disorder. Deaths are unintentional and include car accidents. Assault is when someone who has been drinking attacks someone else. A sexual assault is when someone experiences some type of rape or date rape drug. Academic problems can be either missing class or getting behind on schoolwork. And alcohol use disorder is a chronic disease characterized by uncontrolled drinking and preoccupation with alcohol. Alcohol overdose and its symptoms. Alcohol overdose is defined as when there is so much alcohol in the bloodstream that areas of the brain controlling basic life support functions, such as breathing, heart rate, and body temperature control, begin to shut down. Some symptoms of an alcohol overdose are the inability to wake up, vomiting, seizures, slow or irregular breathing, and bluish or pale skin. An overdose could potentially lead to permanent brain damage and even death. Prevention programs. Below are some different type of prevention programs to help out anyone who is struggling with binge drinking. Locally, any CSUN student can use the university's counseling services to confidentially speak about alcohol or substance abuse. There is also a local program called Aware, Awake, Alive, which was founded by the parents of Carson Starkey, who was who passed away from alcohol poisoning in 2008. It is a program designed to educate college students about the symptoms of alcohol overdose and encourages students to be more responsible for one another when consuming alcohol. A state program is the Community Prevention Institute, which hopes to assist prevention professionals in developing policy strategies to address high risk and underage drinking problems in their community with their publication. Some national programs are the CDC, also known as Centers for Division Control and Prevention, their alcohol program, which aims to prevent excessive alcohol use, and the SAMHSA's, which stands for Substance Abuse and Mental Health Services Administration, and their hotline, which is a free, confidential, 24/7, 365 days a year treatment referral and information service for individuals and families facing mental and or substance use disorders that is available in both English and the Spanish language. This is just my references page. If you didn't realize before, the highlighted portions of my previous slides were in my in-text citations. And that's the end. That's all, folks. This is the end of my presentation. Thank you for watching and good luck during your finals this semester, and I hope you all have a happy and safe holiday season.